Hello and welcome to today's webinar, So You Need to ePrescribe, 3 Things to Know and Consider in 2012. Today's session will discuss the CMS 2012 ePrescribing Incentive Program, 3 considerations to make when selecting a solution, and a demonstration of T-System performance ePrescribing. My name is Ann Beatty. I'm T-System's Senior Marketing Coordinator, and in just a moment we'll be joined by our presenters. If you have any questions that you would like to submit for the Q&A at the end of the webinar, click on the icon with the question mark and type in your question. We will gather these questions and address as many as we can at the end of the session. If we don't get to your question, we will follow up with you one-on-one. We will have a recorded version of this webinar in the event you want to go back and review the material, or if you want to share the presentation with a colleague who is unable to attend. I will distribute the recording to all attendees after the event. And now leading our discussion today are Dr. Maureen Anderson and Robin Shannon. Maureen is a practicing physician at William Beaumont Hospital in Troy, Michigan, and a physician consultant for T-System. She provides input and strategy for new services and solutions designed to enhance the performance of emergency departments. Robin is a registered nurse and the Director of Performance Solutions for T-System. She's responsible for the strategic direction and operationalization of new performance-enhancing solutions. And now I'm going to turn it over to Dr. Anderson and Robin.
All right, thank you, Ann. Thank you for joining our call this afternoon. It's good to take the time to talk about this very important and time-sensitive topic, ePrescribing. As you may know, the definition of ePrescribing is the use of computer and an application that allows access to patient information in order to support the entire medication management process. So we're hopeful that in our relatively brief time together, you'll know a bit more about the incentive program, be aware of some things to keep in mind when considering an ePrescribing solution, and learn about how our T-System solution can support you in meeting your goals and objectives relating to this. All right, so every presentation needs a busy slide, and this is it. This is ours, and the point of this slide is just to say that this is not a trivial measure. This has substantial support on many levels, with lots of things going on in the background, multiple stakeholders. Of course, at the center of this is the patient and the physician or other prescriber. There's also the pharmacy benefit manager or payer and the pharmacist. You then have your application, which is supported by a secure national network, and then you have your various accrediting bodies and other organizations. The key thing to note here, the real centerpiece of this ePrescribing initiative, is the fact that you will be getting real-time information, decision support, that will impact efficiency and safety. Okay, Robin? So as you can imagine, this ePrescribing initiative is gaining momentum and traction. Lots of ePrescribers, as you can see. Lots of ePrescribing software and applications, which makes it challenging for you, which is why we want to make sure you're armed with the best information possible. And the great thing is that there are now many, many pharmacies connected into this network to support this initiative. As you might imagine, the primary care physicians are at the forefront of the ePrescribing initiative. Of course, the primary care physicians often prescribe probably the biggest bulk of prescriptions in general. But as you can see, the subspecialists are on board as well. Now, this slide shows you the percentage of patients for whom payers can provide prescription benefit and medication history information. And although there are a few states that have only 41 to 50% of patients with this information, you see in the vast majority of states there's a minimum of 50% or more patients that have this information available, and in many cases more like 75, 80, or 90%. All right, so as we mentioned, we are going to be looking at the actual incentive program. We'll talk about considerations for selecting a solution, and then you'll get to take a peek at our solution. So we'll start with looking at the incentive program itself. So as you know, there was an act in 2008 called the Medicare Improvements for Patient and Providers Act of 2008, which established a 5-year program of incentive payments and penalties to promote adoption of e-prescribing. We're now in 2012, where there are both incentives and penalties. The incentive part of it ends in 2013, and you'll see meaningful use coming more to the fore. And however, the penalties continue into at least 2014. It's important to note that you cannot receive incentives under both the Medicare e-prescribing incentive and the meaningful use or Medicare EHR incentive programs. But you can receive incentives from both the e-prescribing incentive program and the PQRS incentive program. So where are we now? Well, it's 2012. If you did not e-prescribe by June 30th of 2011 for at least 10 Medicare claims, you will receive a 1% penalty for all 2012 Medicare claims. However, in order to avoid further penalty in 2013, you must report at least 10 e-prescribing events by June 30th of this year, and you see the penalty increases to 1.5%. The good news is that you can earn an incentive this year in 2012 by reporting at least 25 e-prescribing events by the end of this year. So you can receive an incentive of 1% to offset your 1% penalty from 2011, and you can also earn a 0.5% incentive for 2013. So there is hope. All right, how exactly does this work? Well, first of all, you have to determine the eligibility of the patient encounter. This applies to Medicare Part B claims. The Medicare Advantage claims are not included here. A list of the specific codes is described in the CMS e-prescribing measure specifications, and there are other sources for these codes as well. So for a visit in which at least one electronic prescription was placed, you would report the G code of G8553, and that indicates your participation in the program. It is important to note that you must include all measure-specific coding on the same claim. So you can't go back later and say, oh, by the way, we did e-prescribe for that claim. So be very careful when you're submitting claims related to this. There is a possibility that you would qualify for a hardship exemption, and here are the circumstances in which that may apply. If the provider is unable to electronically prescribe due to local, state, federal law or regulation, if the provider prescribes fewer than 100 prescriptions between January 1st and June 30th of this year, if the provider is located in a rural area without high-speed internet access or available pharmacies for e-prescribing. And you'll need to consult your resources, but the one I read from the AMA is that the deadline for application for this hardship exemption is June 30th of this year. All right, so we see the financial benefits to adopting an e-prescribing program. So let's talk about what we might need to consider when looking at a solution. The first thing is the impact to workflow. You want to get a system that minimally impacts your workflow at a minimum, but ideally makes you more efficient and actually helps your workflow. So first of all, do you have a practice management system? And if so, you do want a system that will integrate with your practice management system so that that demographic information does not have to be entered twice. You want a system that will allow you to access medication lists for prescriptions written by physicians outside of your practice. For instance, if you refer a patient to a subspecialist or the patient goes to the emergency department or hospital, you're going to want to know what prescriptions were written there. But as you know, many patients don't have their own medication list available, especially if there's been a recent change. You want a system that will suggest medications that are covered by the patient's drug plan. You certainly don't want to be doing extra work manually to make sure that you're prescribing a medicine that the patient's drug plan covers. And you want to be very, very careful about alert fatigue. There is the capability for a system to give you so many alerts about every single dye and small chemical additive that you start ignoring the alerts and perhaps missing something that's very meaningful, such as an allergy alert or drug interaction. Next slide, please, Robin. All right, so the second set of considerations relates to the usefulness beyond the minimum 10. Yes, we want the financial incentives, we want to avoid the penalties, but you also want to get a system that has a positive impact and something that you want to use when the incentives go away. So the first thing is safety. Have you ever had the pharmacy fill the wrong medication because they couldn't read the prescription? How about a patient having an adverse reaction to a medication because you were not aware of the patient's complete medication list? How many calls do you receive from the pharmacy for prescription clarification? I guess the other way to ask this is, how bad is your handwriting? How many prescriptions do you write? How many refills do you need to provide, and who manages that? How much time does that take? And what is your current process for documenting prescribed medications? And who keeps up that medication list? So you can look at all these areas to see how you may gain in efficiency. You want to make sure that your system will support that. And of course, all right. Now, consideration number 3 is connectivity. And that's really the name of the game. Maximal connectivity allows patients and providers to reap the full benefits of this initiative. So the first is pharmacy connectivity. You want to get a system that connects to the majority of pharmacies who are participating. And you want to make sure they're doing it in a secure fashion to protect your patient information. Patient connectivity. Do you know how many times your patient is not filling a prescription? Studies out there say that 20 to 30% of the time the patient is not filling the prescription. Would you like to have that information and act on it? We do hear about lost prescriptions sometimes, but we don't always hear about lost prescriptions. So you want to make sure that the system will alert you to these failures to connect with the pharmacy. Community connectivity. Again, you're going to want a system that allows you to collaborate with other providers in the community so that when the patient does go to that subspecialist or hospital, you're fully aware of the medications prescribed there, and they are fully aware of the prescriptions that you have provided. And then practice connectivity. You want to be able to share information among providers in your practice so that the provider covering over the weekend knows the patient's full medication list and is able to act appropriately when the patient calls over the weekend or presents to urgent care over the weekend. And then that provider is able to update the system so that when you walk in on Monday morning, you are aware of what happened over the weekend. Now, you'll hear the term qualified e-prescribing solution. So there are several attributes that a solution must have in order to be qualified. So they're listed here. The system has to generate a complete active medication list with electronic data from pharmacies and pharmacy benefit managers if available. The system must be able to select medications, print prescriptions, electronically transmit prescriptions, and provide alerts relating to route, dosing, allergies, or potential drug interactions. The system must be able to provide information relating to the availability of lower cost alternatives. And again, this may help your compliance rate because one of the reasons patients don't fill prescriptions is because of the cost. And finally, the system must provide information on formulary medications and must be able to provide authorization electronically from the patient's drug plan. So these are the things that you need to take under advisement when looking at a solution. You've heard about the attributes of a qualified system, and clearly our T-System Performance eRx is qualified, and Robin will now walk you through the application so you can see how it may meet your needs.
Great, thank you, Maureen. Let me close the PowerPoint presentation and go into the T-System Performance e-prescribing solution. And I'll give you just a minute for my screen to come up. So this is a very straightforward, simple way to comply with the requirements for electronic prescribing. This is a web-based solution, so it's not software that you install on site or in your facility or anything that you need a lot of IT help with to set up. What you need is an internet connection and an agreement with T-System to license this product, so you access it over the web. So what you would do when it's time to write a prescription is first start by searching for your patient name, or logging in, sorry. So I'm going to log in securely with my username and password, and then I can search for the patient that I want to prescribe on. So this information can come over from my practice management system, or I'm able to enter this information manually as the patient registers in my facility. So when I select the patient, I get a few pieces of information that help me make sure that I can prescribe safely. So it's going to give me a quick place to look to see if the patient has any documented allergies. And you can see this sample patient here is allergic to penicillin. It's also going to track if there's any environmental or food allergies that are important. And then I've got a way to look at other information about the patient, maybe chronic conditions or other things that I might have entered about the patient's previous visit. So to add a medication, I'll just show you a sample of one that I might order on patient Mr. Travers. I'm just going to write a prescription for amoxicillin. I only have to put in a few pieces of the medication name, and it will search for all matches. So here, when it comes to selecting the medication, I've got a nice legible way to read what I'm prescribing for, so I can select the right medication. And then I'll just need to select the strength and form of that medication, and it will give me some alternative choices that might be a better fit for that patient. So let's just say I want to prescribe amoxicillin. It gives me all of the various dosages and routes that are available. I'm just going to pick the 500 milligram oral tablets. And you can see I'm getting a warning that there's a patient has a possible medication allergy. So this is letting me know that I should think twice about giving amoxicillin to someone with a documented penicillin allergy. So that's a good way for it to make information, provide information at the point of care and make sure that you can prescribe in a safer way, that you don't prescribe the medication that the patient might be allergic to. So let's close that out and add a different medication. I'm going to go not with an antibiotic this time, but I'm going to prescribe Lunesta for the patient. So here I've got some indication of that I could select Lunesta. It also tells me that that's not available in a generic form. So that may be a time when I would want to go back and look for a medication that is available in a generic form so that I can improve compliance and reduce cost. But let's just say I'm going to pick Lunesta. It gives me the different strengths that's available in. I'm going to pick 3 milligrams. And here it gives me a warning, a drug warning that says you may be duplicating therapy for this patient because they're already on Ambien. So it might not be a combination that I want to pick for this particular patient. It also gives me some other low-cost alternatives, some generic choices if I tend to go that route. But in this instance, I'm going to go ahead and prescribe this medication just so I can show you how it's transmitted to the pharmacy. So just hit next. And this is where I would enter the information about the prescription and what I want to have it say on the label. So for this patient, I'm going to prescribe 30 tablets. It comes up with a default on how that's usually prescribed, and I'm able to enter that in a free text format if I want to type in a different set of instructions. I'm going to just not give them any refills for this medication because I'm not the patient's primary physician, and I want them to go back to their primary care doc for their refills. I can choose between generic and branded if that's available. And I can let the pharmacy know whether that's a new prescription or a renewal. A start date isn't required, but I can put in that I want it to start today. And then a place to add notes for the patient record. So I'm just going to save that prescription. I'm only going to write one prescription for this patient today. And so it gives me a nice way to preview and verify that I've got the right patient, the right medication, that I've considered the alternatives, that I've got another warning that there's an allergy. And this is where I can make sure that it's documented in my chart because I'll be able, if I wish, to print a copy for the patient's chart. Or I can just go ahead and send the prescription to the pharmacy. It defaults to the last pharmacy that the patient used. And I'm also able to change that pharmacy by inputting the patient's zip code and searching for other pharmacies that might be close to the patient. What happens next is I send the prescription. And in the background, the information is being sent via the web and on the secure network to the pharmacy. So about 95% of the pharmacies are set up on the network to both give and receive information. If I'm trying to send it to a pharmacy that doesn't have connectivity, the T-System application will contact the pharmacy and fax the information over so that you're sure that the information gets to the correct pharmacy. So this lets me know, gives me a confirmation that the script has been sent on my patient, and that closes the loop of safe medication prescribing. So what it does is reduces risk by checking all of the prescriptions I write for duplication therapy or drug allergy or drug medication interaction. It makes sure that all the prescriptions that are written are legible. So they didn't have to write anything that could be misinterpreted by the pharmacy filling the medication, or don't have to get a call back because perhaps I forgot to sign the script or write something in the SIG. You saw where it let me select generic alternatives or alternatives that are on the patient's drug plan formulary. So that should increase patient satisfaction and compliance. And because the prescription has already been electronically sent before the patient ever leaves the office or the urgent care center, you know that there will be less waiting for the patient. When they show up at the pharmacy, the prescription should be ready and waiting. So if they're feeling bad or in a hurry, they don't have to wait for the prescription to be filled. This also can help me save time and money because I shouldn't get as many pharmacy follow-up calls as I might be currently getting. I don't have to manage the paper process in terms of writing prescriptions and giving them to patients, and I can reduce a lot of the callbacks. It also can be interfaced with my patient registration system or practice management system, so I can have the patients that I currently see maybe on a repeat basis already loaded into the system, so it's easy when they come back and I need to enter a new prescription. So that's just a really quick overview of the T-System electronic prescribing solution, and we'll be happy to take questions if anybody has submitted a question.
Thank you, Robin. We actually do have a couple questions that I'm going to go ahead and ask. And again, feel free to type your question into the Q&A box if you have one, and we will try to get to as many as possible. Looks like we have about 5 minutes left, so if we don't get to your question, we'll be sure to follow up with you one-on-one. Our first question is, how does electronic prescribing help patient care? And I think that's a question
all right,
for you.
I can take that one. Well, I know we've been focusing a bit on the incentives and the penalties and the financial repercussions. But remember, this e-prescribing is part of a larger initiative that just aligns financial incentives with a more patient-centric model of care delivery. So the whole point is to help the patient. I know it sometimes doesn't seem that way, but as Robin mentioned, better safety for the patient so that they're getting the correct dose, the correct route, the correct medication, and that it's not interacting with other medications and that it's not something they're allergic to. Patients almost come to expect that you will have a list of their medications. In this day and age, they're kind of funny. You say, well, you're trying to verify their medications, and you say, well, what medications are you taking? And they say, well, you should know that. You have this computer, you should know this. So it's almost a level of expectation. But it's really a big satisfier when they walk out of there and the prescription has gotten to the pharmacy ahead of them, and potentially that medication is waiting for them when they go to pick it up. And the whole business about looking for lower cost alternatives is a big deal to many patients. And so that is also a benefit to them. All right, what else?
Thank you. All right, we got a couple more here. The next one says, I've been reading a lot about penalties I will incur because I didn't use electronic prescribing last year. Is it too late to get started now?
Right. That's what I'd be asking. Is it too late, and how soon can I sign up? So yes and no, kind of. If you didn't use electronic prescribing in 2011, you're already subject to the penalty. Not anything you can do about that. But you can offset it by earning the incentive. So if you, and you want to avoid the penalty for 2013, which is higher. So you really want to get on board and get your 10 events in over the next 4.5 months. And you can offset the penalty from last year, and you can earn yourself a little bit of an incentive for next year.
Okay, next question says, I've heard that many vendors are offering electronic prescribing applications. Why is T-System better?
Maybe I can take that one. I think that probably with, I would say with over 250 million visits that have been documented using T-System solutions, that we are well positioned to understand the acute care environment and help you support your goals. Our electronic prescribing application has been designed to fit into the workflow of a fast-paced environment because from a clinician point of view, one of the main goals is to make sure that whatever solution you choose doesn't slow you down. So we've customized this with medications that fit your specialty, and it works well with our T-Sheets, digital share solution, or T-System EV. We also provide some extensive training on the system, and we have a support staff that's available 24/7. So I think it would be a good fit for a lot of our different facility partners.
Okay, and then it looks like maybe our last question is, how do I get e-prescribing from T-System?
Let me go back to the PowerPoint so you can see our contact information. But you can contact us at tsystem.com, or our phone number is 1-800-667-2482. And so you can call that number and ask to speak to your representative who can help you through that process of selecting